You're watching Asia Prime. Malaysia is hit by COVID cases boom.
New COVID-19 cases climbed to nearly 8,000 on Thursday. And on next Monday, Malaysia will open the nation's first mega vaccination center.
Malaysia Health Director General Nur Hisham Abdullah reported 7,857 new infections. This is a new daily record that pushed the country's total cases to more than 500,000. It marked the third straight day where daily cases soared above 7,000. Total deaths have also spiked to beyond 2,300. The Health Ministry issued a poster on social media earlier this day calling for medical officers, dentists, nurses and technicians, among others, to volunteer their services in the fight to contain the pandemic. While volunteers will not be paid, Nur Hisham tweeted that they are sorely needed to alleviate the burden of health workers nationwide. Malaysia's daily cases have accelerated after the Muslim Eid festival despite a one-month near lockdown until June 7, and officials warned the further spikes. The country has tightened movement restrictions and beefed up its vaccination program. On Monday, the biggest vaccination center will be opened in Malaysia International Trade and Exhibition Center. Priority will be given to some 2,600 senior citizens. The location is expected to see over 5,000 people vaccinated daily. The government said it will make improvements to the registration system so that the goal of achieving group or herd immunity before the end of the year succeeds. In July, Malaysia will receive nearly 16,000 more COVID-19 vaccine doses, so hopefully the vaccination rate is expected to increase to 150,000 injections a day by next month.
And to know more about the latest update in Malaysia, we have Nadia Musin live from Kuala Lumpur, Malaysia.
Well, Nadia, it's been 4 consecutive days. Daily cases soared above 7,000. What is the reason and what is the biggest cluster reported?
Well, today we recorded another high. We recorded another high cases with 8,200. Well, I think it is obvious, and we can say that Hari Raya Idul Fitri cluster were among the main contribution to the rising number of COVID-19 positive cases. Well, although the government has imposed several restrictions prior to Hari Raya celebration, it seems like the rule has been violated. Somehow, people had to find a way to go back to their hometown and to do this, to go back to their hometown, mudik, and it was reported a rising number of positive cases in several states caused by city folks who made trip to their hometown during that period. Well, 12 community clusters in 7 states were detected. A total of 2,541 people were tested, with 470 confirmed positive. Of these cases, there was one fatality in Selangor, and beside that, clusters at workplaces or offices also contributed to the surge of cases. Well, currently there are almost 600 active clusters in Malaysia, when a total of 233 clusters are directly linked to workplaces, involving around more than 16,600 active COVID-19 cases altogether.
Okay, Nadia.
So the situation is...
Okay, Nadia, seeing the rising numbers that is happening there and the restrictions that has been imposed and which has been violated by the people in Malaysia, how is the government responding?
Well, based on today's cases, the government said they were aware of the current situation with the spike numbers of cases, and the senior minister, Dr. Sri Ismail Sabri Yaakob, just now in his Facebook posting stated that he will bring the matter to the PM, although he did not mention anything about a total lockdown. Well, health authorities have repeatedly urged members of the public to carry out a self-lockdown and only leave their houses for essential activities. Well, last week, the government, like I mentioned before, the government has imposed a stricter rule under the MCO 3.0, but it does not involve the full lockdown, similar to the one that we had imposed last year, simply because of the economic situation. But look at the numbers today. we have exceeded 8,000 cases. Well, however, the state government of Sarawak in Borneo decided to implement a full lockdown following the rising case in the state itself, which recorded almost 700 cases today. So this was decided by the state government, not the federal government. So it only involved Sarawak state alone. So the health minister also called, like you said, for the medical professional to volunteers in this. And the rate of ICU usage of COVID-19 cases has already exceeded capacity at 113%. I mean, among the steps that have been taken include to synchronize management of critical beds in the COVID-19 hospitals in the Klang Valley, to ensure a greater efficiency and to facilitate the increasing need. And other steps include, elective surgeries and procedures have been reduced and postponed in a Klang Valley hospital, and this hope will free more bed for the treatment of COVID-19 and also enable medical personnel to mobilize to more critical area, and the ordinary ward also have been repurposed for critical beds to accommodate the increased need. Day by day is increasing and terrifying, really.
Talk about vaccinations. Critics are focused on online vaccination program. There has been very bad. Why is that? What went wrong? And are there any plans for additional vaccines to arrive anytime soon?
Yeah. What went wrong? I can say everything went wrong for us. Well, on this registration issue, this was during the registration for the second round of the opt-in AstraZeneca COVID-19 vaccine program. So the registration, this is the second round. So I registered for the first round. The first round went okay, went smooth, without any hiccups. Maybe during that first round, people didn't pay much attention, of the AZ vaccine at that time. Maybe they just want to wait and see other people to take, and they just want to see the side effect of it. And some of them just got no confidence on this particular vaccine. But as the cases increases, fear is rising. Majority of the people still didn't get their vaccine yet, and they've been waiting for months. So I guess, this is when everybody rushed to register and the system crash. So when the government opened the registration, the feedback was overwhelmed. So earlier reported that all the slots were taken up in less than 90 minutes after the registration opened. Well, it started slight delay in the registration. It started at 12:15. It's supposed to start at 12, and the whole process met with frustration and anger among applicants who could not access some features available on the registration site. So much for a 70 million ringgit website. Well, following the incident, the government said action will be taken against quarters responsible for causing these technical problems during the registration, which resulting in difficulties among applicants. However, some of the applicants who could not complete their registration on that particular day will somehow manage to book their slot and only to be notified a day after. Well, for your information, the opt-in AZ vaccination program will no longer be available. Other who doesn't secure the slot will now get vaccinated under the National COVID-19 Immunization Program. So the government announced that the supply of the vaccine will increase in the coming months with an additional 12.8 million doses from Pfizer and BioNTech. So this will bring a total amount of 44.8 million, so it's enough to cover 70% of Malaysian population. Well, at the moment, just under 3% Malaysia is fully vaccinated, though the government aimed to achieve herd immunity by the end of this year. So the government targeted to achieve 150,000 jabs daily in June. So let's just hope that the program will roll out efficiently and according to plan without any delay or double standard treatment.
All right, as we closely monitor the situation in the coming days. Nadia, thank you. Stay safe. Nadia Mohsin reporting live from Kuala Lumpur, KL, Malaysia. Moving on from Malaysia to Taiwan. where it faces its largest outbreak since the beginning of the pandemic. When confirmed cases rose, testing became its biggest roadblock as labs struggled to process all samples coming in from potential patients. The cluster of infections from the pilots had spread to employees at a quarantine hotel and their family members. Then the number of confirmed cases started to climb up by the second week of this month, and the island is now counting roughly 300 cases per day and almost 5,000 cases in total. It had primarily relied on genetic or PCR tests that are seen as the gold standard for diagnosis throughout. The result was overworked lab technicians, backlogs in testing, and a scramble to set up testing sites. Last Saturday, Health Minister Chen Shih-chung announced the adjustment of 400 cases to the number of confirmed cases from the prior week, reflecting a backlog in tests. The backlog is being driven large part due to a lack of manpower on the front lines and in the labs, and not enough PCR machines in the labs. Taiwan was praised globally for its success in keeping the coronavirus out, but now it faces its largest outbreak since the beginning of the pandemic.
The city that was once Australia's worst COVID-19 hotspot on Thursday announced a 7-day lockdown, its fourth since the pandemic began. The Victoria's statewide lockdown, which begins at midnight, comes after a traveler from India became infected early this month with a highly contagious Indian variant of COVID-19 while in hotel quarantine in South Australia state. The traveler was not diagnosed until he returned home to the Victoria capital, Melbourne. By Thursday, the number of cases in the Melbourne cluster had risen to 26, including a person who was in hospital intensive care, Victoria Acting Premier James Merlino said. Australia's second largest city last year underwent a second wave of infections that peaked at 725 new cases in a single August day at a time when community spread had been virtually eliminated elsewhere in Australia. That lockdown lasted for 111 days. A third lockdown that lasted for 5 days in February was triggered by a cluster of 13 cases linked to hotel quarantine near Melbourne Airport. Victoria accounts for 820 of Australia's 910 coronavirus deaths.
And still more stories coming to you ahead. Stay with us here on Asia Prime. You're watching Metro Globe Network.